Hi everyone, welcome to my channel. This is my first video, so I'm sorry if it's really terribly done, but I'm filming this in my old bedroom in my parents' house because of the lockdown currently, and I'm using all natural light, so I'm sorry if the light cuts in and out, and I'm sorry if you hear my cat in the background. She might start scratching at my door. So yeah, I hope this goes well, and let's get to it. This video will be discussing Don Davies' proposal in the House for universal pharmacare and universal dental. It will also be discussing his proposal for PPE and medical equipment to be manufactured here in Canada, and that long-term care homes be federally regulated. Here's the video of him discussing it.
It is New Democrats' hope today that we will seize this moment in history to recognize this fundamental health, social, and economic accomplishment and take this unprecedented opportunity to build on it. Never again should Canadians be vulnerable to a shortage of personal protective equipment for our vital frontline healthcare workers or those who must deal with the public at a time of pandemic. Never again should we be dependent upon the vagaries of other nations, be it China or Donald Trump's America, for our essential medical equipment and supplies. Never again should we leave millions of Canadians at the mercy of precarious employment-based health benefits, where folks are one layoff away from losing access to life-saving medicine. Never again should a child with a rare illness or vulnerable condition go without their medicine because their family can't afford it. Never again should we witness a single senior citizen live or die in long-term care in disgraceful conditions of soil, neglect, or indecency. So let us cultivate a vibrant, made-in-Canada health industry for our national self-sufficiency and economic advancement. Let us act with haste to create pharmacare, the next phase of Medicare, by adding prescription drugs and devices to our public healthcare system. Let us create national standards for long-term care, respected and enforced, with a federal transfer to the provinces and territories contingent upon meeting high-quality standards, good wages and working conditions, and public delivery. Let us rapidly expand virtual care so every Canadian can get access to quality services no matter where they live, especially those who live in rural or remote areas of our great country. Let us get to work on the myriad of other ways we can improve Canada's healthcare system, from dental care to community delivery to smart investments in illness prevention, like school nutrition programs.
So just in this video, Don Davies proposed that the federal government regulate long-term care facilities under the Canada Health Act. So that means that the provincial government has to meet certain regulations or certain standards in order to receive funding from the federal government, like our universal healthcare system. So this will better regulate the homes and will hopefully take out the for-profit aspect of the homes. So I know he didn't directly bring up the Canada Health Act in this video, but later in the week, that is what he used to explain the regulating process that the federal government could do to protect long-term care facilities in the provinces. So he did go on to state specifically that that would be something the federal government should do. Considering that many people have died in long-term care facilities due to the neglect of the long-term care facilities, specifically because either they're heavily undercovered and many of the workers work part-time and have to work between facilities and sadly could spread the virus. Also on top of that, the for-profit aspect, because there's also in Ontario many long-term care facilities that are privately owned. And this is just a huge problem that we definitely need to fix. Secondly, Don Davies brings up universal pharmacare and universal dental, that should be implemented, which actually the NDP has already brought this up in the past. Specifically, universal pharmacare, the motion is already passed in the House as we speak. The motion for pharmacare actually passed right before the crisis. And this would be the perfect time for the federal government to pass universal pharmacare as emergency legislation, considering that a statistic came out this week that almost 2 million Canadians lost their jobs throughout the crisis. And that means most likely almost 2 million Canadians have lost their coverage for pharmacare and dental that is covered under their jobs. What I mean that their pharmacare and dental is covered under their jobs is that I mean that it's tied to their jobs. Like in the United States, how all of their healthcare is tied to their jobs. So you have an insurance company that provides pharmacare and dental through your job, and as soon as you lose your job, you lose that coverage. So that means most likely 2 million Canadians have lost their coverage for pharmacare and dental. And our healthcare system is already heavily overburdened, sadly, by the COVID-19 outbreak. And this could be a crisis in itself because many kids and adults, obviously, are covered under their job's pharmacare that's provided through insurance companies. And if you lose that, you could have many people go in sick to the hospital for preventable illness if they were able to afford their medication and be able to take it properly. Thirdly, Don Davies brings up that Canada should manufacture our own PPE here and medical equipment. So we no longer have to rely on China and America ever again to get vital medical supplies into the country, like PPE and medical equipment. Some of you may remember that we struggled getting PPE from America into Canada because the Trump administration specifically was holding them at the border, PPE, and they also were trying to crack a deal with 3M in the United States to stop sending PPE to other countries and to only do it within the United States, which could have been a huge problem for Canada getting PPE. So Don Davies' proposal would ensure that Canada wouldn't have to rely on other countries for PPE and medical equipment ever again in regards to a crisis because we would already have what we need here. We could also provide many jobs in manufacturing PPE and many jobs manufacturing medical equipment here in Canada, which could help stimulate the economy during the depression we're in. These could be good federal jobs that have a good wage and have good regulations and are unionized. He also goes on to talk about other things like bringing virtual care to rural communities and remote communities in Canada, which could be very vital for them if they don't have doctors within the surrounding area. He also goes on to talk about illness prevention, which would have been vital in this scenario if the Canadian government already had everything that we needed to ensure that we had enough beds for people, that we had the proper PPE. So if a crisis did break out, which apparently the Canadian government was warned on occasions that there is a possibility of an outbreak occurring and they did nothing about that, and that we could have been prepared for this. We need to get the message out there that Don Davies and the NDP are specifically proposing that all long-term care facilities be federally and provincially regulated under the Canada Health Act, that we should implement universal pharma and universal dental, and that PPE and medical equipment should be manufactured here in Canada. And it's so important that we get this out here because the mainstream media won't talk about it and will continue to ignore that the NDP is proposing this. So please like and subscribe if you liked this video. Once again, this is my first video and I'm very new to this. So I'm sorry about the poor quality and I promise I'll get better. Please comment down below anything that I'm missing and feel free to comment some suggestions of what you'd like to see me cover. And I'll see you guys next time. Bye!